Hi, I'm Dr. Mahboob, MD Ophthalmology from AIIMS, New Delhi. And today we are going to take a very important topic to discuss, and that is the retinopathy of prematurity, ROP. This retinopathy of prematurity was previously previously known as retrolental fibroplasia. Retrolental fibroplasia. But this was not the true or correct word or terminology to describe this uh, disease. Why? Because retro means behind, lental means behind the lens, fibroplasia, there is a fibrous proliferation. So behind the lens, there is a fibrous proliferation. That's why this term means this. And that's why it does not correctly define the retinopathy of prematurity. However, we can say that this retrolental fibroplasia can be considered as a complication. This is a complication of ROP. So it is not at all the definition of ROP. Now, coming to the regarding the very important thing that when this occur in a premature infants of less than 1.5 kilogram, 1500 gram, rather we can say, or before 30 weeks of gestation if they deliver, then this kind of ROP things develop. So before we go, whatever I am going to explain, everything is important for the exam. Okay. Now, what is this? I have written early exposure. The early exposure to high ambient oxygen concentration is being regarded as the key risk. In the exam, the question will include that the patient is requiring the ICU stay where they give them 100% hyper ambient oxygen or hyper saturated oxygen, and this hypersaturated oxygen is a key risk factor for development of ROP. What did this do? What this higher concentration of oxygen do? A, this causes a singlet formation of O2, oxygen radical, and they can all damage this. One. Second point is that this hyper or high concentration of oxygen, basically what it causes the VEGF, that is vascular endothelial growth factor 2, the to release very fastly, and because of this hurriness, इतनी जल्दी जल्दी करने के चक्कर में, because of this hurriness, what happened? There is the formation of immature blood vessels. Okay, the immature blood vessels, and which will ultimately leads to the some sequelae of events will take place. We will discuss about this later on. Basically, we should know what is the basic pathology behind this ROP. If you know that, you will be easily able to understand everything. Suppose I am making a fundus photo. Since disc is on the right side, so it's a right disc, right side fundus, right eye fundus. Okay. Now what happened in, I have written that the retina has no blood vessels until the 4th month. Means there is nothing, no blood vessels are developed until the 4th month of the age. But after that, around 8 months, the nasal periphery, 8th month, the nasal periphery blood vessels will develop, and temporal blood vessels will develop around 1 month after birth. Okay. So similarly, what happened when there is a premature birth before 30 weeks? Obviously, we can say that these two blood vessels, matlab the blood vessels of the retina has not been developed fully. and that's why the oxygen concentration of high, then they will causes the hyper release of this VEGF, which will causes the formation of immature blood vessels. In most of the cases, this ROP will not take place, and the blood vessels development will take place as it is, as the normal process. Okay. Now coming to this point, very important to understand for you. In 2005, International Classification of Retinopathy of Prematurity, that is ICROP, was made, and they have divided this ROP into the different sections like zones, stages, and the plus stages. So we will discuss about the zone first. Let me tell you what is this one. This blue circle, this is a zone 1, this is the zone 1. The red one is the zone 2, and the remaining part is the zone 3. How will you determine? The most of the posterior pole are in the zone 1, in the blue circle. This blue circle has a radius of, has a optic disc in the center, that is optic nerve in the center here, optic nerve in the center, and the radius is the the double of the distance between optic disc and the fovea. Okay, so this is the circle, very simple. Now if we consider this as a center, this optic disc as a center, and we take the radius as the distance between this optic disc and the nasal periphery, and we draw a circle like this, and we draw a circle like this, then we get a 2, that is zone 2, and the remaining temporal crescent is regarded as zone 3. So this is about the zone. Why it is important that anything happening in the blue zone, that is posterior pole, that is zone 1, is more devastating, more deteriorating. ठीक है, जो zone 1 में जो भी होगा, that is more deteriorating. Okay. Coming to the second point, that is stages. There is a sequelae of event takes place after ROP. You know, I have told you that VEGF will roughly increase in amount, causes the immature blood vessels to develop, and then the sequelae of events takes place. This sequelae of events is break into the stages. First, between this is a vascular retina and this is the avascular retina. At the junction of vascular and avascular retina, there is a line. See this line? See this line? So this is called demarcation line. This is flat. This is flat. Okay. Now, just see here, at the junction of the vascular and avascular retina, where the demarcation line was there is a ridge formation. Means some elevated, the retinal portion has become elevated up to some extent, and this has become ridge. Okay. Now this is the second stage. Third stage, what happened, because of the VEGF release, at this area, the blood vessels immature blood vessels starts to form. Immature blood vessels start to form. They die very fastly. And what is the, I mean, after death or after the formation of immature blood vessels, they heal, they undergo degradations, and in the fibrous form. So this fibrovascular proliferation takes place here. That's why this stage is called fibrovascular proliferation. Now, because of the fibrous conversion of this immature blood vessels, there is a traction over the retina. Because these fibrous vessels contract, they causes a traction over there. So there can be the partial tractional retinal detachment, rather we can say. If it is extrafoveal, means if it is not present around the fovea or near the fovea, it is 4A. But if the partial retinal detachment takes place near the fovea, or foveal area, then it is called 4B. And if there is a total retinal detachment, then it is a stage 5. So you understand, just remember the word demarcation line, ridge, fibrovascular proliferation, partial retinal detachment, and total retinal detachment. Now coming to the very important thing, that besides the zone and stages, we have plus digits. What is this plus means? Can you see the vessels is tortuous like this one? Can you see the major vessels are tortuous in all quadrant, right? Here in this all quadrant. So if there is a dilated and tortuosity of vessels more than equal to two quadrants, then this is called plus disease. Okay, this is very important because this guides in the treatment. Moving to the fourth point, that in some time that we know now stages, that there is the first demarcation line, then there is a ridge, then there is a fibrovascular proliferation, then there is a tractional retinal detachment partial, then there is a total retinal detachment. This is a sequence that is usually being followed, but in some cases around the posterior pole there is aggressive conversion or aggressive um, what we can say aggressive deterioration of the disease from stage 1 directly to the stage 5 or stage 4 within a week, because the stages which is usually followed takes much more longer time, 6 months, 1 year, 1.5 years. But if this from stage 1 to stage 5 jumping or stage 4 jumping takes within 7 days or very fastly, then this disease is known as aggressive posterior ROP. And you know, this is an emergency case, and that's why it is also known as a rust disease. And you have to treat this immediately. Treat immediately. As soon as it comes into your clinic, hospital, you have to treat this. Coming to the important thing that is very important as far as the exam is concerned, that they always ask you when to when to screen a patient, when to screen a baby for the ROP. So there is a American Academy of Ophthalmology guidelines. They say that if the baby is less than 30 weeks of gestational age or less than 1500 grams, then you should undergo the screening procedure. But there is also one thing that they have said, that if the gestational age is more than 30 weeks or more than 1500 grams, still if there is a suspicion of the ROP by the pediatrician, or if there is a ICU stay, then obviously we should go for screening. ICU stay also. So this is very important. It's not an hard and fast. However, for the sake of convenience, you should remember this. Now, what I have written, the when is the first initial screening to be done? 4 weeks of birth or at 31st weeks of gestation. Suppose a baby born at 23rd week of gestation. When you are going to do this? So you are going to do the first screening around 31 week only. Okay, and when the baby takes the birth around 28 week, then you are going to do the first screening at 32 weeks, because how 28 plus 4 resulting in 32, so you have to add 4 weeks, means that you should not go first screening before 31 weeks. Okay, but if the 4 weeks gap is beyond 31 weeks, then you have to add 4 weeks and then do this. Similarly, in a 29-week baby, when you are going to do the first screening, add 4, it is 33. But in 26-week baby, you add 4, it comes only 30. You are not going to do on 30, you are going to do in 31, because whichever is more important. Okay, you understand the screening part. Moving to this one, treatment part. Basically, previously, old theory was they identify the threshold disease and pre-threshold disease. So basically, in a patient, if at any stage, if we are going to treat, if you are not treating that patient, if at any stage, if you are not treating the patient, and the patient, more than 50% of the patient undergo blind, then this is called threshold. More than 50% go blind if not treated. So this is pre-threshold, and anything which is not threshold, they are considered as pre-threshold. But this is not followed nowadays, right? What is being followed? It is early treatment retinopathy of prematurity. इसी के जैसा है हमारा एक ETDRS, early treatment diabetic retinopathy study. They can ask you the full form also. So in the diabetic retinopathy, the study was early treatment diabetic retinopathy study, but in this ROP, it is early treatment retinopathy of prematurity. Now they have classified the disease into the two parts. They have classified the disease into the two parts, type 1 and type 2. Type 1 may simple means type 1 requires a treatment within 72 hours and type 2 requires just observation. But you should know that what comes under type 1 and what comes under type 2. Basically, for the convenience, remember, if there is a plus disease, it will always come under type 1. Okay. And if there is a stage 3 plus zone 1, and it will come under plus disease. Just remember two things. If there is a plus disease, it is type 1. If there is a no plus disease but stage 3 and stage zone 1, it is a type 1. Like this. If it is a plus disease here it is type 1, and if it is a stage 3 plus zone 1 without plus disease, it is also in the type 1. These two things you have to remember. बाकी आप देख लीजिए any stage zone 1 plus digits, stage 2 or 3 zone 2 plus digits, they come under this, and you have to treat this within 72 hours. Coming to this point, what happened when other than that, without plus digits, they are coming under the type 2. But I have told you stage 3 plus zone 1 without plus digit is type 1. In the type 2, you have to do observation only. Regular follow-up is very important. So if at all we require the treatment of the patient, what you are going to do? You are going to do the first thing is the laser. Where you are going to laser? You are going to laser at the junction of, suppose this is the, there is a blood vessels right here, but here is the junction of avascular and avascular retina. So at the junction of vascular and avascular retina, you are going to do laser. Also, you are going to put the anti-VEGF to inhibit the VEGF secretion. And if at all there is a tractional retinal detachment takes place, total retinal detachment or tractional retinal detachment takes place, then you are going to do pars plana vitrectomy in this type of the patient. Okay, so the most common, they can also ask you the most common type of retinal detachment in the ROP is tractional one, not the rhegmatogenous. It's a tractional retinal detachment. Most common type of retinal detachment in diabetic retinopathy is also tractional retinal detachment. Okay, so this is about the ROP, very important to know, and you have to go through each and every points that I have discussed. Hope you like this video. Thank you very much.